lytter til Samtaler om stress. Podcasten, der tager dig hele vejen rundt om stress. Din vært er stressbehandler Linda Klod Præstholm, som tager dig med til faglige eksperter og dem med den helt personlige historie. Linda brænder for at give dig kvalificerede oplysninger om stress og nye perspektiver på samfund og individ. Rigtig god fornøjelse.
Velkommen til Samtaler om stress. Det her afsnit, som I skal høre nu, det er på engelsk. Og det er med den kanadiske læge, der hedder Russell Kennedy. Han har skrevet bogen, der hedder Anxiety RX, og betyder sådan en recept på angst. Det har været en stor glæde for mig at læse Russells bog, fordi hans syn på angst responderer rigtig meget med min erfaring og min faglighed. Så jeg var vildt glad for, at han ville tale med mig. Jeg var også lidt nervøs. Jeg håber, at alle kan følge med på engelsk. Jeg taler naturligt nok ikke så hurtigt på engelsk, og Russell Kennedy han har gjort alt, hvad han kunne for at tale et langsomt engelsk, så os, der ikke har engelsk som hovedsprog, kan følge med. Ellers så kan jeg anbefale dig at høre det nogle gange. Hans bog er rigtig god. Den kan både læses som almindelig bog og som lydbog. Og det som han gør, det er at han også selv gentager sig selv mange gange, fordi det er en ny forståelse af angst, vi skal ind i. Rigtig god fornøjelse. So welcome, Russell Kennedy.
Thank you.
To my podcast, roughly translated as conversation on stress.
Okay.
So I cover all kind of topics in relation to stress. So the reason I reach out to you is because of your book,
Yeah.
Anxiety RX, and you're the Anxiety MD.
Yeah.
Yeah.
That's true.
And the book was out when, in 2020?
Yeah, it came out in October of 2020. At the end of 2020, it came out.
Yeah.
So it's been out almost 18 months now.
Yeah. And I saw you, I think, on Instagram, because you're quite active on Instagram.
Yeah.
Yeah. So I was just like, yeah, it looks like a great book. So I bought it and I read it, and I was so happy to read your book, because it talked right into my experience on anxiety and my thoughts about it. But you have just put more words into it, because I come as a trauma therapist, so somatic experiencing a trauma therapist. And when we have anxiety, it's normally something with our nervous system. So This is what you speak into.
Yeah. My wife is an SEP as well. And I'm actually doing the SEP training right now myself.
Oh, good.
Yeah.
It's a great training.
It really is.
Yeah. All right. So I have some questions for you.
Certainly.
Yeah. And normally this podcast is in Danish, and as we talk about our nervous system and activation, I would like to address my own nervous systems right now.
Absolutely.
Because I'm quite nervous about speaking English. So I'm thinking about,
great.
Do I use the right words and all that kind of stuff. But now I said it, so maybe I'm less nervous.
We've had a conversation before, and you did just fantastic. So I don't think you have to worry about that at all.
Thank you. So I would like to ask you about, what is the cause of your interest in anxiety?
Well, mostly because I grew up with a father with schizophrenia. And a lot of my childhood was worried that I was going to have the same condition that he had, because it was so devastating. You know, he'd be in the mental hospital and he'd be psychotic or horribly depressed. So there was a lot of me that was really worried that I was going to wind up being schizophrenic like him. And I think I worried so much that I think I gave myself an anxiety disorder. Now, I never did wind up getting schizophrenia, but I certainly did give myself anxiety. And through medical school and even in practice, like I've dealt with anxiety for a long, long time.
Wow. Can you remember when you first thought it was anxiety?
Probably early on in med school. When I was probably in my early 20s, up until that, I just felt that I just had this sense of like impending doom. Like there was this sense that something was going wrong. I didn't really know what it was. And it was my body just preparing for trauma. And my body was, my heart rate was up. I'd sweat a little more than normal. My muscles were tense. I would clench my jaw. So until I got, probably into pre-med at university, then I started really sort of seeing, hey, this might be something called anxiety. And then I started really focusing on it a lot more. Actually, that made it worse. Once I started knowing that it was actually something, I started worrying about it even more.
Oh, no.
Because before it was just a sense of like, well, I just thought that I was, really sensitive and really kind of fixated on things and trying to keep myself safe and all that kind of thing. I didn't actually know it had a name until I got into pre-med. And then once I found out it had a name, a lot of people find that when their condition has a name, it makes them feel better. For me, it made me feel worse.
Oh, okay. But I think nowadays we are more familiar with anxiety.
Oh,
don't
yeah.
you think? So people with anxiety today would probably discover it before.
Yeah.
In their life.
Yeah. Although, Linda, I have lots of people that send me messages saying, I've read your book. I didn't know I had anxiety until I read your book. And they're in their 40s, 50s, and 60s. So I think there is generally a more awareness about anxiety, but I think a lot of people just assume it's them. They just assume that that's how they are. Oh, yeah. And they don't know that there's actually something that can be really done for it, because a lot of people don't seek medical attention for it too. 20 to 40% of people with anxiety don't even seek their family doctor or a psychiatrist or a psychologist. They just assume that that's the way they are.
Oh. Yeah, makes sense. So it was your own experience with anxiety. And I read your book, so I know your history. But sure. Can you tell a little bit about, because you are very personal in your book. So this is also, it's I don't know, it's
memoir kind of.
Yeah, and it also makes it more, you can relate to your thoughts when you use yourself. This is a very
and my patients. Yeah, and my patients too. So through the years, I picked certain patients and certainly myself, and I just, I really examined things very, very in fine detail. And so I examined my own anxiety in really fine detail. But it wasn't really until I started doing like LSD or ayahuasca or those psychedelics that I really started to see that my anxiety, and this goes along with somatic experiencing, of course, had more to do with this old trauma that was stored in my body. And my mind was just really just reacting to the old trauma in my body by making up these scary stories. So I assumed that it was my mind that was the problem. And I think that's why it took me so long to heal, because I was trying to fix my mind when the problem was really centered in my body, as we talk about in somatic experiencing, trying to find those old traumas that when we were younger, we weren't able to deal with because we were children. We didn't have we didn't have a parent or a caregiver that was able to help us with it. So it just stayed in us. And then because the thoughts seem to immediately come before the fear, we assume it's the thoughts that create the anxiety, when actually it's a state in the body of readiness, of alarm, of activation. That's the real cause of the anxiety. The thoughts are basically just kind of a byproduct. The thoughts are just kind of the symptom rather than the underlying cause. And I think what we do in therapy a lot of the times is we try and fix a symptom, which is fixing the thoughts, and which makes you feel a little bit better in the short term, but it doesn't really do anything for the root, the underlying cause, which is this old alarm, this old trauma that's stored in your body.
Right. So let me just unfold all these things,
Sure.
because there was a lot of information at once. So your breakthrough insight about anxiety is that it's something in the body. It's a state in the body. Is that right? That was your insight on LSD and ayahuasca?
Yeah.
Yeah.
So LSD and ayahuasca showed me when my mind was kind of fractured on LSD, and I don't know how I got this message, but it showed me that my anxiety was in my chest, around my solar plexus. It was purple. It was like the size of a fist. It was a pressure and a pain that pushed up in my heart and into my back. And I never would have seen that had I just done conventional therapy. Mm-hmm. And then once I started to see where my alarm actually was, which was the root cause of my anxiety, then I started directing, soothing to that part of my body and connecting with that part of my body. And that's what really helped me heal, because that was the actual source of the anxiety, as opposed to trying to chase it in my mind, because it wasn't in my mind. It looked like it was in my mind, but it was actually in my body.
Mm. So there was a lot of wisdom in you, I think, to work with it when you saw it.
Well, it was the only way out, I think, Linda. Like I had tried everything for 30 years. I had tried, CBT and ACT and psychotherapy and all the talk therapies, and none of them really seemed to help. They helped in the short term, but didn't really do anything in the long term. So once I started looking at, hey, why don't I try and soothe this part of alarm that's in my body that is really probably my younger self? It's probably my 12 or 13-year-old self that's still kind of trapped in my body with that trauma. So if I can access that younger version of myself and make him feel safe, talk to him, make a connection with that younger version of myself that holds the trauma, and really allow that to come through, then I really started to heal, because I was actually, like I said, going at the root cause of the anxiety, which is my younger self. Mm-hmm. There is a theory in psychology that if you experience a significant trauma as a child, part of you stays at that age for the rest of your life until you heal it. Mm-hmm. And that makes sense if you look at the neuroscience. If you look at the neuroscience of the amygdala, which is often called the fear center of the brain, which is not really that accurate, but the amygdala never forgets anything that's ever hurt you, and it also has no sense of time. So that when you get something in your present day environment that reminds you of the old trauma that you went through, say for example, your parents argued and yelled and screamed at each other a lot, and then you hear yelling and screaming down the road that has nothing to do with you, it can still trigger all that old feeling in you. And that's how we have to, go back, find that young child and nurture them and love them and form a connection with them. And that's how I believe that we ultimately heal the root cause of the problem, as opposed to just trying to change the thoughts, which only help in the short term.
Yeah. Has your discovery, or what you can call it, on anxiety changed anything in how you operate as an MD, medical doctor?
Well, as an MD, I didn't really have time to go into this with my patients. Mm-hmm. So what I did was I retired early from medicine, because I felt that I really wanted to help people with anxiety. But that took, it really takes about 60 to 90 minutes with people to really go into that history, to find the child in them, to find their trauma, to find where they feel it in the body. And as you know, in somatic experiencing, it takes a while. Mm-hmm. You have to go slowly with this. So I didn't really have the time to do it as a medical doctor. So I retired from medicine, and now I do it sort of privately, like one-on-one mentoring, coaching for anxiety and that kind of thing, which I find much more rewarding than just being a medical doctor.
Yeah, so you can say you changed a lot in your way of
Oh, I
working because you wanted to use it.
Yeah.
Yeah, yeah.
Well, in my medical practice, I would see 30 or 40 people in a day.
Okay.
Right?
Yeah.
Yeah. I mean, people would come in for prescription renewals, or they had a bladder infection or an eye infection, or their chest hurt or something like that. You know, things that I could probably deal with in 5 or 10 minutes. You know, but emotional issues take a lot longer. So I may only see maybe 2 people a day these days, as opposed to back then when sometimes I would see 40 or even 50 on a weekend.
Wow.
Yeah. And I'm not sad that I'm not doing that anymore, because that seeing 50 people in a day. I was quite a popular physician in this sort of trauma center that I used to work in, this sort of urgent care. So people would wait 2 or 3 hours to see me, which was good in a way, but it was also mean that I would have to stay around and see, 50 people before I could go home.
Yeah.
So I'm much happier doing this kind of work than I was doing medicine. Even though I love medicine, I just feel much more powerful and impactful doing this. I feel like this work that I do now really makes a big difference for people.
Yeah, I can relate to that very much. Can you explain what you mean by what you also said before, the alarm anxiety cycle? Or there's a sentence in your book. It says, the alarm stored in our bodies is the creator of the anxiety, anxious thoughts.
Yeah. I think there's a process called interoception. I'm not going to use too many technical terms in English, but it's basically when the mind constantly reads the body, because your brain is constantly reading your body to adjust different things, right? So if you have this alarm, say for example, as a child, you were physically hit by your parents, so that trauma stays in our body, and the mind is constantly reading the body. So when the mind reads this old pain in the body, it creates a painful worry to be consistent with that pain that it feels in the body. So if your mind picks up this or detects this pain, it's not going to make stories about puppies and picnics. It's going to make stories that are scary. And then that's what I call the alarm anxiety cycle. So the alarm in the body is read by the mind in this process called interoception, where the mind goes into the body and reads it. It feels the negative energy. It makes a negative story, and then the body believes that negative story that it's telling you, because the body reacts in a very similar way to a story as it would to something actually happening. And then that creates more alarm in the body, which of course creates more negative thinking. So you get into what I call the alarm anxiety cycle, which is very, very difficult to get out of if you don't know that you're in it. And I was in it for 30 years before I really figured out what I was in it. Wow. So once you figure out that the alarm is causing the anxiety, the anxious thoughts, and the anxious thoughts are causing more alarm, you can start separating the two of them, where you can allow yourself to feel and connect with the alarm, but you don't necessarily have to automatically link it into a thought. You can realize that your thoughts are only guesses that your mind is making, and those guesses are wrong. So once you learn to separate the two, then you start healing. While you're hooked into that alarm anxiety cycle together, you can't heal because you can't see the real cause of the problem. But once you see that you can separate the alarm in the body, that old trauma that you experienced, from your thoughts, and you don't have to compulsively add thoughts to it, then you can start to heal.
So this is actually, it's not new for me, but a lot of people think that it's the thoughts that are creating the anxiety. So I'm just taking it one more time.
Well, which makes sense.
Yeah.
Right?
So what you say is it's the thoughts that are feeling something in the body, or the brain is scanning the body, and then it trying to make a story about what's going on right now. There must be something dangerous happening. And then the thoughts are making a story about what is going on in our nervous system.
That's essentially what happens. Because if you imagine, a 6, 7, 8-year-old child who's, say, emotionally, physically, sexually abused, that is too much for their little minds to comprehend. So they wind up suppressing it or repressing it into the unconscious mind. And then the body is kind of a representation of the unconscious mind. So it gets stuffed, those old traumas get stuffed into the body. And then they're not really paid much attention to after that. But the alarm is in there. So the alarm is paid attention to by the mind, because the mind feels it. The mind feels that old trauma. And it has to do something with it. It can't just sort of sit there with it. The mind is a compulsive, meaning-making, make-sense machine. So it has to do something with that negative feeling in your body from your old trauma. So it makes up a bunch of negative, warnings, worries, what-ifs, worst-case scenarios. It makes up all these things to try and guess at what the problem is. But it guesses wrong most of the time. And then because the worry seems to start the problem, we assume that the worries of the mind are the problem, and they're only actually a symptom of the underlying problem, which is this old trauma that's still locked in your body.
Mm-hmm. Yeah, and well, I'm thinking it could also be, something else than a trauma. I just talked to a good friend, and she told me about, she was on vacation, and the flight had a kind of turbulence, and it jumped up and down, and some people were screaming. Yeah. And that is frightening for our bodies. Yeah. When the ground is shaking. It would also be frightening for me if my floor started shaking now.
Absolutely.
And then it could be just that, and then my mind starts to think, this flight might fall down.
Absolutely. Yeah, it's the same. It is the same kind of thing. So, anything that your nervous system perceives as a threat. Yeah. So that may be the fact that you were hit as a child. That may be the fact that you were emotionally abused as a child, or it could be that you were in a car accident, or you were in an aircraft that was going through turbulence. Anything that the body perceives as a threat to your survival is a type of trauma.
Yeah. Okay. So, and what I also meet is a lot of people with stress, because this is my job.
Yep.
And stress is also an activated nervous system.
Sure.
So this is also a kind of threat. And this is why a lot of people with severe stress is also having anxiety in more or less degrees.
Yeah.
Yeah.
And if you've had childhood trauma, if you've had physical, emotional, sexual abuse as a child, you're much more likely to experience stress as an adult, because you never really learned how to deal with it back then. Most of the time when you experience these traumas as children, the child doesn't have anyone to tell. They have no way of discharging this trauma, so we hold on to it. So as we get older, we have more stress in our life, we're much more likely to feel that stress more intensely than, say, someone who didn't have a childhood wounding.
Yeah. So you could say that what you would do as an adult, you would calm your nervous system, you would calm your body, and maybe you didn't learn it as a child.
Yes,
you didn't have the experience repeated enough. Yeah.
That's exactly right.
Maybe it's a little bit of a repetition, but I like the term so much. So can you talk about the thing that you called background alarm and
Sure.
foreground alarm? Because what you do in your book is that this alarm in the body that you're talking about, you divide it into two types of alarm.
Yeah.
Can you
so
say
let's
a little
take
bit?
Yeah, let's take your example of the woman on the plane. Mm-hmm. Right, with the turbulence. Yeah. So what she will get what I call foreground alarm, which is everybody has, which is what the sympathetic nervous system, often called the fight or flight nervous system, it activates anytime that we face a threat. Regardless if you've had trauma as a child or not, you will react in this way. So your heart rate increases, your blood pressure increases, you may sweat a little bit, your pupils change to absorb the environment better. You go through this sort of trauma reaction. And that's what I call foreground alarm. So that's something that's in your foreground. It's in the obvious environment that you're in right now. So if you started having an earthquake, you would start getting foreground alarm. Your heart rate would come up. If you were on a plane that was, shaking through the sky, you would get sweaty. You would get worried. Your body would start to get tense. So that's what I call foreground alarm. That's what everybody has. Now, background alarm is what comes from your background, typically what comes from your childhood. So if you did have, a traumatic event when you were younger, if you got into a severe car accident as a child, or if you experienced, like I said, emotional, physical, sexual abuse as a child, that goes into your background and it gets stored in the background of your body. But it's always there. It's, it may sort of come and go, and it typically comes up when you're in stressful environments in your day-to-day life. So let's take two people on that same plane. One person never had any childhood wounding, and the other person did. The person that didn't have any childhood wounding would feel alarmed. They would feel the plane shaking and wonder, oh my God, I wonder if the plane's going down. But the person that had childhood wounding would probably feel that much more intensely because they've got this old alarm in their system. So their background alarm gets activated by their foreground alarm. So when their blood pressure goes up, when their heart rate goes up, that brings up that old trauma as well as the current trauma. Whereas the other person that has no background alarm will only feel the current trauma. So I call it background because it sits in the background in your body, and it comes from the background of your life, typically from your childhood. So background alarm is old alarm that hasn't been resolved in your body, typically from abuse or trauma. And foreground alarm is what we all have, is kind of like the fight or flight reaction when we experience threat. So those are the two differences. And each one activates the other.
Mm-hmm. Yeah. Okay. It makes a lot of sense for me when I read it, because it's a good way to look at it. Because sometimes when you feel something, you kind of scan the environment. What is wrong here? I can feel some reaction in me. What is wrong here? And then to think about, maybe it's just your background alarm that is now activated. There's nothing wrong here.
But the thing about that is when your background alarm gets activated, you will go into a survival mode in your brain and your body, and then you will look specifically for threats in your environment, even when there's no threat there. And if there's no threat in your current physical environment, typically that's when people start to get into worry, because they need to make sense of it. That mind needs to kind of make sense of this uneasy doom feeling. It's like, oh, it must be because my taxes are due, or it must be because I'm afraid that person might have COVID. The mind has to find a reason why it feels this way. And typically it will, if you've got, and most people with anxiety I find are quite intelligent and have good imaginations. And I think a good imagination in someone with anxiety actually makes them worse.
Yeah.
Because they can imagine all the horrible things that might happen.
Exactly. And it's oh, my dog is barking.
It's okay. I have 3 dogs, so keep going.
I say the exact same things to my clients, because it's the same with stress, right? Because this is also an activation in your nervous system. And a lot of people say, okay, I have all these stressful thoughts. Can you help me to calm the thoughts?
Right.
And I say, well, the thoughts are just a reaction of your nervous system. So it's not the thoughts that are your problem, but it's the state in your nervous system that's a problem.
Exactly. Yeah, and that's exactly what it is. And unfortunately, as human beings, we make the mistake that we believe that it's the thoughts that are the problem. So we get all this therapy for the thoughts, but we never actually get better because we're not actually getting at the true cause of the problem. What I say is if you have a fire on 3rd Street and you send all the fire trucks to 1st Street, you're not going to really put that fire out.
Yeah. So how do we put the fire out?
Yeah. Well, what I usually do is I'll get people to find where their alarm is located in your body. And this is something I'm sure that you do every day, is when someone thinks, say they had I have a guy whose parents, whose father used to hit his mother when he was younger. And I would say, okay, I know him fairly well, so we've been able to develop this relationship. We don't go into this big trauma right away, but after a while, I've been able to, imagine, close your eyes, ground yourself, ground your feet, take some breaths, and then I want you to imagine a situation that, say, he didn't, he maybe pushed her a little bit, or he wasn't really, hitting her that hard. Like, can you feel that in your body? Like, when you imagine that scene in your mind's eye, can you imagine it? And he'd say, yeah, I kind of feel this pressure in my chest and up into my throat. And it feels cold, like cold steel. And then I'll watch what he does with his hands, and see if there's a movement that kind of replicates that. And then I say, okay, can we just stay there for a while? Can we just slow that down? Can we stay with that sensation for a while? And what I'm trying to do is get him to acclimatize, or get him to get used to or adapt to that feeling, so that he doesn't automatically have to go into that worried state of mind and all the worrisome thoughts that go along with it. So in a way, I'm separating this old alarm that he holds in his body from the thoughts, and I'm splitting off the two of them so that they're not connected to each other and they're not energizing each other. And then the more I get him to sort of breathe into that sensation and breathe into that feeling, the more that feeling kind of fades away or changes or calms down. And then, we do this other process that I'm sure you're familiar with called pendulation. I find a place in his body, say his upper chest, where he feels lighter. And then we go back and forth, like, let's go back into that feeling where your father was, pushed your mother or whatever. Now let's go to a nicer feeling in your body, or something that's neutral. And we go back and forth, because what we're trying to do is we're trying to create this situation called integration, where this old disparate, or this part that acted alone that causes all this pain, now we can kind of join it with something that feels good, or at least neutral. And then it doesn't create so much pain anymore. And when it doesn't create so much pain, there's not so much need to make sense of it in the mind. So we start getting to the point where people can acclimatize to their old trauma and their old alarm, and actually feel like they've got a sense of control over it, rather than it automatically going into these horrible, catastrophic situations. Mm-hmm. So that's one of the ways that I work with people as well. But it's finding the alarm in the body, seeing that alarm is probably your younger wounded self, and can you connect with that younger version of yourself? Because that version of yourself is asking for your love and attention, just like it would have at the time that the incident was happening.
Mm-hmm. Yeah. So you could also, in somatic experiencing, we talk about separating the feeling from state of emergency, or the danger from the feeling, that we separate these two. So this is what you're doing. Yeah.
Exactly. Yeah. And then once people see kind of unconsciously that they don't have to, they're not locked into this feeling anymore, then they can start to metabolize it. Then they can start to allow it to kind of flow through their system, as opposed to it being this hot ball of fire that just sits in the same place all the time.
Mm. So I can imagine that maybe you had met some resistance on this.
Oh yeah.
Because there's a lot of types of anxiety where people can be, I'm not talking down to people who have it this way, but there is a tendency to categorize your anxiety. So you can have health anxiety, you can have
social anxiety, airplane anxiety, there's all sorts. But it really, I think it all comes from the same place. I really think it does. It all comes from the same place. And it's basically this old alarm that's locked in your system, and it may manifest in me as being afraid to go to parties. In someone else, it may manifest as not wanting to get on an airplane. As someone else, it may manifest in being paranoid about their health. But it's the same root cause for all the anxieties, and they just get labeled differently, in my opinion.
Yeah. So you say to people, there's nothing called health anxiety, for instance. So
yeah, I mean, it's all anxiety. It's just basically that health has been kind of the bucket that your mind has decided to put it into. And perhaps you had a sick parent when you were younger, so you observed sickness firsthand. So it kind of became part of your repertoire in there. Or you had a bad experience on an aircraft. So now you're afraid to fly. And it's really nothing to do with the actual turbulence on the aircraft. It's a place in you that's afraid, and then you've decided to put it into this, what I call a bucket of being afraid of flying, or being afraid to go to a party, social anxiety. It's all the same anxiety. It's just we decide which label we're going to kind of put onto it. And typically that comes from our experience as children.
Mm-hmm. Yeah. So do you also have the experience about some kinds of anxiety can manifest like somatic sickness? So
yeah.
For instance, anxiety can manifest as I can't, swallow,
yeah.
Or my heart rate is really high, or I have a tingling feeling in my arm or in my back. And so the feeling of anxiety hooks into, anxiety for, is it something really bad?
Yeah.
Or do I need a whole medical, examination? Or do I need to call
absolutely
911? Yeah.
Absolutely. Yeah. I mean, people, again, it's like they want to find a reason. They know something feels odd. Say they get heart palpitations.
Yeah.
They know that feels odd. They've read somewhere that heart palpitations can be the sign of a heart attack. And now all of a sudden they've got themselves convinced that they're having a heart attack, when really they're just having heart palpitations, which is what happens to 25% of people at any point in time. You'll get heart palpitations. It's a normal sensation. There are certain, there's something called Globus Sensation, where the cricopharyngeus, the muscle that sort of surrounds the trachea, gets a little tense, and it has this feeling like it's kind of cutting off your airway a little bit. It's not, but it's just this sensation. And then people will fixate on it. They will focus on it to the point where they start believing that they can't breathe. This is how powerful your mind is.
Yeah.
So your mind is essentially looking for a reason why you have, and as a medical doctor, I've seen anxiety cause just about every, gut symptom, throat symptom, ear symptom, just about every cause. And then we do all the CT, MRI, investigations, blood work, and nothing comes of it, because it's coming from anxiety. So I have seen anxiety or alarm create just about every type of medical condition that there is.
Yeah. And how unsatisfied it is to work at the hospital and not being able to say this to the patient, because I've been there. I'm a nurse. So, yeah, I worked at cardiology.
Okay.
Yeah, so there was a lot of anxiety.
Absolutely. And if you look almost at a spiritual level, your heart is kind of like your spiritual soul in a lot of ways. And as a medical doctor, sometimes this seems this is kind of out there for me. But I really realize that, like, I'm also a yoga and meditation teacher. I'm also seen some things on psychedelics, taking LSD and ayahuasca and all these things that really make me see that we are these spiritual beings having this physical manifestation of life. And we want to explain everything, and we can't. So when you can't explain something and it goes into sort of like the spiritual aspect of it, for a lot of people, that creates a lot of angst and a lot of worry because they can't actually have a specific explanation for it. So it's really hard for people because when you have, you know, if you have like stomach pain or whatever, like I've never seen a case of irritable bowel syndrome or fibromyalgia who didn't have childhood trauma.
Yeah.
Like it always seems to go together. But people want a reason. They want a medical diagnosis because they know they feel it, but they don't realize that it's actually the alarm in their system that's causing the problem in the first place. And the alarm is really there to create this knowledge of your younger self and that wounded child. And that's what you have to go back and help. That the child in you is what you have to go back and connect with and help soothe and satisfy, because when the child experienced trauma when they were younger, they didn't have a parent that helped them. Mm-hmm. So now you as an adult have to be that you know, protector, that person who loves that younger version of yourself. And that's how I see people healing from anxiety, is when they actually find that younger version, they find the child that has the alarm, and they start making friends and developing a relationship with that younger child and reassuring them now like they should have been reassured back then when they were kids and they experienced the trauma.
Yeah. And there's a lot of things I want to say to that. But the thing to heal your wounded child in you, I think it's, also think that that's your experience, that it's great with help. Because sometimes you can't imagine how it would feel like if you never experienced it.
Yeah.
So it's a great thing to do it with a therapist or somebody who can do these or master these kind of methods. Because, you can't tell a person, well, take care of your inner child if you never knew how it was supposed to feel.
Yeah, and especially, Linda, if that child is hurt, right? So as human beings, we, as any organism, we have this instinct to avoid pain.
Yeah.
So if we know there's a child in us who was abused, abandoned, neglected, whatever, we don't want to go back and visit that child because it's too painful. But that's exactly what we have to do if we really want to heal, is to go back, find that child, and reassure and give them the love now that they should have got back then. That's how we heal. But that said, a lot of us don't want to go back and revisit that child. We'd rather just keep, pushing it away because it hurts. So, that's the bravery in therapy, is going back and finding that child. And that's the only way you really heal the root cause of the problem, is going back, finding that child, giving them the love, attention and support now that they didn't get back then. That's how you heal. You don't heal by changing your thoughts and, every time you think of something bad, you snap an elastic band or whatever. That helps, but it doesn't heal you. The same with medications. Medications will help numb that pain, but it won't heal the underlying cause. Nobody has ever been healed by using a medication. It numbs the pain, but to heal, you have to go back, find that child who was hurt, and show them that you will look after them. That's how you heal. That's the only way you heal.
So what do you do if people are on medication?
Well, we try and get them, to get in touch with their alarm, to understand what's happening in them. A lot of people get tremendous amount of relief just knowing that their anxiety is actually this sense of alarm that's been in them since childhood. And it's not their mind. They're not crazy. It's not their mind. Their mind is actually acting normally. With this alarm in their system, their mind is acting normally because there's a stress there. Yeah. And the mind is acting exactly as it should when there is this stress in your body. So once people know it's not really my mind, it's actually this old wounding that's in my body, they start getting a sense of relief right away because they know intuitively that this is the ultimate cause of the problem. And then when they start working on it, they start feeling so much better because there is this sense that they are fixing the root of the problem as opposed to just trying to fix their thoughts.
Yeah. And do you take them off medication then, or?
Slowly, yeah, slowly. And a lot of people will wind up taking themselves off medication. I mean, we have to titrate it. We have to do it slowly, in increments. But when people start feeling better and start feeling like they have some control over the situation, if you feel like you're completely out of control and your emotional state is at the whim of the wind, you know, whatever's happening in your life is basically going to dominate your psyche, then they can't get off medication because they see medication as something they absolutely need to cope. But when they start seeing they have some control over the situation and they want to start feeling more, because a lot of what happens with anxiety and a lot of the mental disorders is that your emotional range narrows and narrows and narrows and narrows. And I see people who say are invited out to dinner with someone that they're excited about, but they'll get really, really anxious because they've forgotten that excitement is different than anxiety. So when they feel excited, they've trained themselves so much that this feeling of flushed or, you know, this kind of energy that's in their body is bad. So they'll feel anxiety rather than feeling excitement about seeing a new movie or going out to dinner with a new friend. You know, so your emotional range narrows over the course of time. So once you start seeing your emotional range widen and you can feel the good and the bad, that's when people decide, you know what, maybe I don't need this medication so much anymore.
Yeah. Okay. I'm also quite preoccupied by psychiatric diagnosis at the moment.
Sure.
So you could also, I think, with this approach to anxiety, say that it's not even a diagnosis, because it's just a group of symptoms.
Yeah, the root cause is the same. You know, the root cause of eating disorders, depression, anxiety, OCD is almost always, you know, emotional wounding in childhood. Almost always. You can have PTSD as an adult, absolutely. But almost always the big ones, the ones that are very intense, are almost always from childhood. So when you see that, excuse me, when you notice that and you know that, then you have a route back to finding the root cause of it, as opposed to just trying to chase your tail by chasing the symptoms. So what happens is that trauma that we experience as a child. So say one child gets, you know, beaten by their parent, you know, like physically hit by their parent, and that child develops depression as they get older. And that same child might develop anxiety or might develop an eating disorder. The root cause is the same. It's the way that it manifests in people that's different. So this whole thing about the DSM is basically just trying to make sense of the different manifestations of what really comes from almost exactly the same thing. So if you look at anxiety, you know, anxiety is, you know, anxious thoughts, rapid heartbeat. That could be 15 different things. But we put it into these little areas because we try and explain it. But really, you're really trying to just lump something together that kind of holds together loosely, but really isn't a specific diagnosis. You know, like if you look at something like, say, inflammatory bowel disease, like Crohn's disease or something like that, that has, you know, bloody stools, cramps, pain, that kind of thing. That's a specific diagnosis. You look at that. But if you look at someone with anxiety, they may get a completely dry mouth, or they may get headaches or pain behind their eyes. Now, that may be different in every other person that has anxiety. So how are you supposed to develop this one, you know, series of 9 things that everybody has with anxiety? It doesn't work that way.
Yeah. And still we call it anxiety, and a lot of people get the diagnosis anxiety. Yeah.
And I'd prefer if we threw out the term anxiety altogether and just called it alarm, because that's really what it is. It's really a state of alarm in your body, and the anxiety is just your mind's way of making sense of it.
Yeah.
So, and then, people go out and they say, I had a friend who said, I go out and I tell my friend I have anxiety, and my friend doesn't really understand what I'm talking about because they've never experienced anxiety. But if I tell them I'm feeling really alarmed today, that friend will know exactly what I'm feeling because everyone's felt alarmed at different points in their life.
Yeah.
So it just, the words carry consciousness, and I don't think anxiety as a word has a lot of consciousness to it. But I do think alarm does, because everyone's felt alarmed.
Yeah. And it can also be good to feel alarmed.
Yeah. It's a warning system. It's kind of telling you that something isn't right in your system.
Yeah.
And how can you maybe go back, find that child, even though it's painful, find that child, bring them back into the fold, bring them back into love, bring them back into relationship. And that's how they release the alarm, and that's how you heal. Because once the child releases their alarm, they release it for all parts of you.
Yeah. But it can also be a good, you walk in a dark street, especially maybe as a woman, and you hear somebody behind you. That's also alarmed.
Absolutely.
And that's a good thing.
Yes, it's a warning system, So a chronic alarm is a warning system that you're not, probably being consistent with the younger version of yourself. And that would be analogous to the foreground and background alarm. So if you're walking down a dark street and you see a shadowy figure, that's foreground alarm. That's normal. If you're walking down a street in the middle of daytime and there's children everywhere and that kind of thing, and you're feeling completely afraid, that's background alarm. That has nothing to do with what's going on right now.
Yeah. Right. And I also felt a bit of foreground alarm before talking to you. And I told my husband, I'm so nervous. And then he said, well, it's good to be a little bit nervous, because then you are a little bit sharp and focused, and
it does activate you for sure. Your sympathetic nervous system is there to activate you. The problem is, for those of us with anxiety, is when our sympathetic nervous system comes up, we tend to go into that automatic, oh my God, oh no state, rather than, this is exciting. This is interesting. This is something that I really want to do.
Yeah.
And so many of us with anxiety stop doing the things that we want to do because we assume that they're dangerous, but they're not. It's only excitement. It's not anxiety.
Yeah. Right. So I can almost hear some people ask me about, how long does it take?
Yeah, it's a good question. It really depends on how deep the alarm is. Some people have alarm in their system from before the age of 7 years old. So say, your dad died when you were 4 or something like that.
Your parents got divorced.
Yeah, so that kind of stuff, right?
Yeah.
So it's what we call pre-verbal trauma. And a lot of people do very well with touch work as well as like SE work. Cynthia, my wife, is she's certified in SRR, like with Kathy Kane and Steve Terrell, and like the touch work as well, because the words, we have something in our brain called the hippocampus, and the hippocampus really helps us understand language and understand us integrate things. But the hippocampus doesn't form until we're like 18 months old, so we don't really create structural memories that well before the age of 18 months old, and even after that we don't. So when we're dealing with kind of a memory situation where we don't have the words and we don't have a story for it, it's hard with somatic experiencing when we don't have a story. We can still do it, but it's, so how long does it take is basically what you asked me. Depends on how deep the trauma is. It depends on how strong your defense mechanism is. It depends on how much you trust your therapist. It depends on how much you're ready to let this go. Some people aren't really ready to let it go. And there's a whole bunch of factors that I know when I work with people, but awareness is probably the biggest one. Like just being aware that this is a state of alarm that's in your system, that's probably been there since you were a child, and connecting with that younger version of yourself and making the intention that you're going to connect with that younger version of yourself is really, really helpful, because that child's been waiting for you. Like it's been waiting for you. Depends on how, like I'm 60, right? So my child was waiting for me for almost 50 years. So it is like the child is waiting for you. It's a matter of having the bravery of going in there, having a good therapist that you feel safe with, to kind of bring up some of those old traumas. And the more willing you are to go into those old traumas, the faster you'll heal. But you also have to do that at a very regulated pace too. You can't just go in and say, this weekend I'm going to heal my trauma and blow yourself up because it's too intense.
I come every day for the next 14 days.
Yeah.
No, that's too much. Yeah.
It takes a while because it's like you move something and then you wait a few days or a week or 2 weeks or whatever, and then it kind of settles. And then you move it again 2 weeks later, and then it kind of settles. So it's kind of like this 2 steps forward, 1 step back thing. And healing isn't a linear process. It's not, all of a sudden I'm going to therapy and it's getting better. Sometimes when you start therapy, it gets a little bit worse because you're dealing with the stuff that you've been stuffing down for so many years.
Yeah, true. And also this connection to feeling the body is my experience that it takes some time, and I usually compare it to learning a new language, because it is your brain that are learning a new language if you ignored the feelings in your body. So you have to say, okay, this unpleasant feeling here is like something, tightening, or it feels like a knot, or it feels hot or cold, or how big is it? To distinguish these sensations is actually like learning a new language.
Yeah, and it's the language of the body. And the language of the body will show you how to heal if you tune into it. If you just keep trying to figure it out with words do help explain it. But if you just use words, you're probably not going to heal that quickly. But if you actually adopt into the language of the body and the wisdom and the language of the body, it wants to heal. Like the body wants to heal. It really does. But you have to give it the right conditions.
Yeah. And I can imagine that it also, it will feel safe for some of your clients to sit with a medical doctor who has healed his own anxiety.
Yeah, I wish more doctors. I think that's one of the problem with allopathic medical doctors is a lot of them haven't done their own work. Medicine is one of those fields where when you go into it, they don't treat you very well. You work 36-hour shifts. Well, you work in a hospital, right? You know the doctor mentality, and it's not self-care. It's not kind to ourselves. It's drive. And when you do that for a long, long time, you lose the ability, or you lose touch with the ability to really connect with the real version of yourself. And you just work harder and harder and harder and get more and more burned out. And I think that's why the reason why so many medical doctors are burned out is because of our training. We're trained to ignore our body. That's basically what it comes down to. Yeah. So you can't, after 30 years of ignoring your body, you can't expect to be mentally or physically healthy. It just won't work that way.
No. I had a talk with a nurse today just about that, because it's so stressful. And we came down to this, but you have no choice than to be in a sympathetic activation the whole workday.
Yeah.
There's basically almost no chance to be in a parasympathetic state as a nurse or as a doctor.
Yeah. But you can teach yourself, to take bathroom breaks. And when you're, if when you're in the bathroom at the mirror or whatever, like looking at yourself in the mirror, putting your hand on your chest, taking a few breaths. There is this old, this thing, it's in North America. I don't know if you've seen it where you are, but it's this professor, and he holds up this cup of water, like this coffee mug full of water. And he says, if I hold this coffee mug up for half an hour, I can do it. But if I hold it up for 4 hours, my arm's going to ache. If I hold it for a whole day, my arm's going to feel like it's going to fall off. So even just short periods of putting it down and having the intention of connecting with yourself and breathing and feeling the floor and getting into your sensation is very, very helpful. So, it's a case of a little bit goes a long way, especially, and then once people start seeing, especially doctors and nurses start seeing that does work, then they start creating more self-care for themselves. Because I think the reason why so many of us burn out is we don't take care of ourselves, and we lose touch with the ability even to think about taking care of ourselves. We're just so busy taking care of other people, and that provides us with it feeds us on some level helping others. But if you don't feed yourself, eventually you're going to burn out.
Yeah, true. That was a good advice.
Yeah.
Well,
I am a doctor, so
yeah, with the hand on the chest and looking yourself in the mirror.
There's a bunch of different things you can do. Yeah. Like sometimes I get people that like just do some circles on your chest, right? Yeah. There's another thing that I get people to do is cross their hands across the midline and put your left fingers on your right cheek and your right fingers on your left cheek and just stroke your cheek. Because if you look at the somatosensory cortex of the brain, so much area of the brain is devoted to your hands and your face. So when you touch your hands with your face, even pretending like you're washing your face, that kind of thing, it draws you into the present moment sensation, because there's so much real estate in your brain for your hands and your face that when you touch your hands with your face, your brain can't ignore that. It's just too much stimulation. And if your brain was previously ruminating and worrying, now when you put your hands on your face, half of that energy is now devoted into sensation, and half of it was taken away from the rumination of the thoughts. So it actually helps you think less.
Yeah. Oh, great. I will try to do that a little bit more.
Yeah.
Yeah.
Well, if you notice, if you do it, like, and anyone listening, like if you put your right fingertips on your left cheek and your left fingertips on your right cheek, and you just slowly stroke it, you'll know how dominant that sensation is. Like it really takes over so much of your attention.
Yeah. Okay. So I think we've come to an end.
Thanks. That was great.
Yeah. So thank you very much.
You are more than welcome. Thanks for the invitation. I'm just getting over COVID now, so my throat is a little rough and that kind of thing too. But it's been a pleasure speaking with you.
Yeah, you too. And I can recommend to read your book.
Sure.
And also to follow you on Instagram.
Yeah, everything is The Anxiety MD. So at The Anxiety MD is Instagram, Twitter at The Anxiety MD, YouTube The Anxiety MD. If you just Google The Anxiety MD, I'm all over the place.
Cool. Thank you.
Thank you.
And good health to you.
And same to you.
Yes.
Tak, fordi du lyttede til Samtaler om stress. Husk, at du meget gerne må dele Samtaler om stress, som er en usponsoreret podcast. Det betyder derfor rigtig meget for alle, der deltager, at podcasten kommer ud til så mange som muligt. Så tryk abonner og smid meget gerne en anmeldelse fra det medie, du lytter fra. Du kan læse meget mere om stress og behandling af stress på hjemmesiden behandlingafstress.nu. Følg også Linda på Instagram under stressbehandling, eller find hende på Facebook under Linda Klod Præstholm, behandlingafstress.nu. Stemmen, du hører her, tilhører Anders Brandt. Kan du nu passe rigtig godt på dig selv?